7th year.
Yes, sir.
He nevertheless came, as he always does, on Monday night to the shiur in Parshanut, where we learn not only Torah, but we banter and we wordplay, and it is a delightful shiur. That's a plug if anybody wants to come. We're delighted at this wonderful turnout. May it be a harbinger of things to come. You are used to the idea that the best professionals in their fields come here to brief us on very important issues. And yes, they do come because of its being a community service, and they like to serve the community. And Linda Spiegel out there, shout out to Linda Spiegel, and to NYP, and to also Margaret Tietz, and for all of the help that they have throughout the series. But really, nothing would happen if it weren't for Dr. Mel. It's because he asks people to come that they come. It's because it wasn't accidental that he had Kol HaNe'orim, the Aliyah with all of the children this year, because he is one of those people who is forever young, and we are delighted to be the beneficiaries of his eternal youth and the fountain that he has founded and found. Dr. Mel, please come back.
Yeah, it doesn't. In red it works, but like, go off.
No, it's not going on. There's a light.
No, if it's red it works. The battery's low, but.
Testing. I think you're going a little heavy anyway, so let me get rid of this thing.
That's what I set up before.
Anybody has difficulty hearing, please raise your hand, and I'll step up the tone. Got more water here. Thank you, Robert Rosenberg. I'd like to thank all of you for coming tonight. Can you hear? Okay. Can everybody hear now?
Yeah.
Okay. I'd like first to thank each and every one of you for coming tonight, and I hope I can convey some knowledge to you. Little did I think 6 years ago, when I got up here to give the first talk in this series, along with Dr. Marie Welsinger, that we would be going on every month through the year, except in the summer, and that we'd have enough topics to keep your attention. But medicine changes every day with new findings, new treatments, and even abandonment of some old ones. We have a great array of talks for this year, and I will allude to some of them as we go along. There is a list on the bulletin board outside, and I would recommend that you come to each of them, unless you really can't. First, I would like to give thanks to those people who deserve it. Howard Schoenfeld has been our technical director from day one, and even before. And makes it possible for those of you who cannot be here to see the programs on our website, and those of you who are here to hear us. Thank you, Howard. Linda Spiegel, Director of Public Relations at the Margaret Tietz Rehab Center, was the first person, really, that I asked as to whether or not this would work. Remember that day?
I do, in my office.
And Mrs. Oppenheimer was there. And she encouraged me then, and to this day, aside from providing our guests with stationery and a smile at all times.
Thank you. Thank you, guys.
The Community and Public Relations Departments at NYPQ have been instrumental in helping us get speakers, and especially Barbara Foote, and Willa Brody, who has gone on to a better job. I imagine all of you went to college at some time, and there was always somebody in the class who took notes that you wanted to have. She's here tonight. Susie Garber of the Queens Jewish Language. and Yaakov Searle have faithfully gotten our message out to the rest of the public. And of course, Rabbi Moshe Rosenberg and the board of directors of Chaim have provided us with venues and lots of encouragement. Certain politicians have been helpful also. I'm only going to mention one because he's not running for anything, I don't think, and that's Jim Gennaro, who actually helped encourage us to start. Okay, let's.
And I would also add that a model of health and proper diet that I have witnessed in your house is Norma Bright.
And that is true. And anything you hear about food tonight and nutrition comes through her and her cooking. She will give lessons to anybody who wants them. Finally, I want to thank the late Gladys Salmon and Ben Basat for providing us with something in her will that allows us to give refreshments and to help us get certain things done. Now let's get to the topic. I've chosen to speak about the changes in adult medicine over the past 2 years. I can't really qualify to talk about pediatrics. There have been many, and frankly, I'm going to be talking about common problems. I do not think some of the obscure things, they're important, but we're not going to talk about them. I'm also not going to talk too much about what's going to happen in the future in terms of rocket science stuff. That isn't available to you. I want to talk about things that you can use right now. Again, some of these problems are, some of the things that have happened this year are counterintuitive or are reversals of what you've been told previously. Many of you are familiar with the comment. Now, some of the things I'm going to say are controversial. Many of you are familiar with the comment, if you have any doubts, ask your local Orthodox rabbi. If any problems, ask your local primary care physician or specialist. Specialists are also known as POSECs. I'm going to start off with talking about vaccines because it applies to everyone here and your families. And again, only vaccines. The U.S. Preventive Service Task Force, which I spoke about last year, has a list of vaccines that should be given to all adults. I'm going to talk about ones that are most important at this point and not even the controversial ones. This is the flu shot season. Everybody should get a flu shot every year, as I have since the Hong Kong flu of 1956, unless there's a contraindication. A contraindication is not identical to an excuse. There are no excuses to get a flu shot, again, unless you are allergic to the vaccine or some of the components. If you got the flu from the flu shot you got last year, you either got a reaction, which can happen, or getting some bug, even the flu, before the vaccine took effect. The real flu is nasty. It's not uncomfortable, it's just nasty, and can be life-threatening to some people. This year, 2018, is the 100-year anniversary of the flu epidemic of 1918 that killed an awful lot of people, thousands and thousands, maybe millions. And we don't know what strain you're going to get, but it's going to be coming around. But anything you take will be helpful to fight it off. Flu shots are available in drugstores. If you don't want to see a doctor, sometimes they may be less expensive there. But if you haven't had a checkup, you should go see your doctor and get your flu shot there. Second, there is a new dead virus shingles vaccine. There was a shingles vaccine that was available, that was called Zostavax. It's still available, but it was only about 50% effective. Shingles is a horrible thing to get. The new vaccine is 90 to 100%, 90 to 95% effective, and it might be expensive depending on your insurance, but if you can, I would strongly recommend getting it. It is impossible to get these days because they can't make it fast enough, but I strongly recommend it. I just saw 4 people who had shingles within the last 6 weeks, and it ain't fun, and they're still in pain, some of them 6 or 8 weeks later. Medicare itself is not currently paying for it, but most private insurances are. Check with your insurance company, check with your doctor or drugstore as to whether or not you should be getting it. It's one shot followed by another shot 2 to 6 months later. It hurts, but it's worth it. Tdap, that's tetanus, diphtheria, pertussis, is recommended every year, and if you haven't had any in the last 10 years, not a bad idea to get it, especially if you did not go to school in the USA, because it was required for school, even colleges. Now, this is controversial. There are many pediatricians now who insist that grandparents and other people who are going to be visiting newborns get it because shingles is worse, pertussis is worse for young infants. Louder?
Yeah.
Yes, the microphone.
Stand here.
Okay. Louder.
Okay.
Some pediatricians insist that grandparents get it. Some don't insist on it. Ask your local doctor, your local pediatrician, as to whether or not a newborn coming into your family should get that protection from you. Turns out that my daughter's pediatrician never did recommend it, but Baruch Hashem, none of our kids ever got the disease. There are still people out there who do not take vaccines of any kind, including some Hasidic sects that refuse them. Please note that vaccines have saved more lives than antibiotics, mammograms, and colonoscopies, and anything else you can name. Remember, a lot of people used to die of flu, and a lot of people used to die of smallpox, and various other things. Everybody over the age of 60 should get the new pneumonia vaccine, which is called Prevnar, or pneumonia 13 vaccine. A year later, some people recommend that you get the old pneumonia vaccine, unless you've had it before. That's the 23. The 13 is more up to date than the 23. Don't ask me why the numbers don't match. Not all pneumonias are prevented by this, but the worst kinds are. And if you are a healthcare worker, I recommend getting hepatitis B vaccine. Now, a few things about insurance plans that I want to bring up. I'm not going to talk about insurance. Ask your local insurance maven about that. But two things that are very true about insurance these days. One is you may not be able to keep your doctor. And two, who is your local insurance guy? Right here, walking in. And the costs will go up. Medicare is planning a couple of changes for the coming year that will affect many people. One of them is that they are going to pay primary care physicians and internists and pediatricians, if they're involved at all, the same fee for what's called level 2, level 3, and level 4 visits. These are listed as being visits that are for 10 minutes, 15 minutes, or 25 minutes. Your doctor who used to spend 25 minutes schmoozing with you, dealing with details, going over several different problems, is going to be less likely to spend all that time with you now. And he's more likely to tell you to I'll take care of your blood pressure today, and come back next week, we'll take care of your diabetes, and come back the week after, we'll take care of your cold. It's unfortunate, but that's what they're planning to do. The other thing they're planning to do is they're going to start doing things that insurance companies have been doing for some time, and that's be asking for more prior approvals. A prior approval is what happens, and most of you have heard about it, when you go to your doctor and you want to get a medication that's more expensive than the regular medication or brand medication, or if you need to get an imaging procedure like a CAT scan or an MRI, you have to get your insurance company to approve that. Your doctor, if he's asking for it, generally will be able to get that for you, but it's time consuming, it's very annoying to the doctors. There are some doctors with 3 or 4 offices that hire one person just to do these prior approvals. I call that problem prioria. Telemedicine is here. Telemedicine is where your doctor makes your visit on Skype. And it's possible, and there are people in my group who are doing televised visits and so on. They have to be set up, but many insurance companies are paying for telemedicine, and I suspect that within 2 years, most of us will be doing televisits. That means no hands-on, that means no schmoozing to speak of. It means you can't take somebody's blood pressure directly. It means a lot of things, but there are some people who unfortunately cannot get to your office. I do not recommend it for people who are too lazy to go to the doctor's office or who don't want to wait. One other thing, and again, before I get to any diseases, this has happened gradually, but it's no longer subtle, and that's the proliferation of urgent care centers. Several factors have contributed to this. One is the desire not to go to the emergency room and wait forever when you go there, especially to wait along with uninsured people who won't be accepted at urgent care centers.
Could you try the mic a little further away?
Okay.
You can hear better without the mic.
I think we're good with the mic.
I was going to talk about hearing devices. Urgent care centers have proliferated because, again, you don't have to wait as long. There are better hours and longer hours than your doctor. There's a proliferation of emergency medicine physicians. They've been getting trained now for some time, and they all need jobs, and hospitals have too many emergency care physicians, and most of the hospitals are using physician assistants to do a lot of their emergency work. So urgent care centers have been popping up all along. Unfortunately, another reason is that hospitals themselves have opened urgent care centers because if you're sick, they have a direct pipeline. You go to their urgent care center, they say you got to go to the hospital. They're not going to send you to NYPQ if it's a Northwell urgent care center. The problem with urgent care centers, nobody has really done any studies of them, except one recent one that shows that urgent care centers give a lot more antibiotics than your regular doctor does or anybody else does, or emergency rooms. Why? People who wrote the paper from Harvard think
it's fast and easy.
it's fast, it's easy, and you're coming there to get antibiotics whether you need them or not, and if you don't get them, they'll go to the next one. It's a real fact, and we'll get to that a little further along the line. Another thing that is new, and that all of you are familiar at this point, patients have access to their results. To physicians, nothing is more frustrating than when you get your results and the normal for a test may be 20 to 40 and your number comes back 41 and you say, how come I'm sick? Please use a little discretion when asking for these. They have finally actually stopped doing one thing. There's something called the BUN creatinine ratio, which is a kidney test where they make a ratio. And many labs have stopped giving you the abnormal ratio if the two regular numbers are normal. Only because we beg them, please stop this. Finally, Dr. Google is getting more and more dangerous. Please, understand that if you look something up on Google, you may be getting something very reliable, like the Mayo Clinic, or even Wikipedia to some extent, although that can be unreliable. And very likely you're going to find on top of your list an ad for something that's going to cost you a lot of money and is not going to work. I do not recommend Googling things at all if you can avoid it. Okay, let's talk about what's new. The newest thing in this community is something called a mobile stroke unit. We know that if you have the early signs of a stroke, the best thing to do is to get immediate medical attention. NYPQ now has a mobile stroke unit, which you can access through 911, and I'm going to try to get it accessed through Hatsala shortly, where a truck comes out, and it will take, technicians come out, PAs come out, they will evaluate you, they will sometimes image you and treat you with something called out-the-place, which is a medication that will avoid you getting the full stroke many times, and then get you to the emergency room. And then get access to the people who are going to be speaking here next month about the mobile stroke unit. This is the second one in New York City. The first one is run by Cornell in New York. Doctors Sami Pishandir and Sarika Badu are involved with this. I strongly recommend that you come here a month from now and hear about the mobile stroke unit and other advances in neurosurgery. That's the first part. Talking a little bit more about stroke, atrial fibrillation, which is an irregular heartbeat, which is found in maybe 5 to 8% of people in this country, is very common, and atrial fibrillation is often a cause of stroke. It is well known now that atrial fibrillation, if you have it, should be treated with blood thinners, and I'll get to blood thinners very shortly. If you are told by your doctor that you have atrial fibrillation, decide with him which blood thinner you are going to take and make sure you get it. What is controversial is if you do have a stroke, whether or not, and a normal heart rhythm, whether or not we should chase down and do all kinds of fancy tests to see if you have atrial fibrillation, including wearing a monitor on your, like just they stick on you or sew into you for a few months at a time. Not a bad idea, although in the future it may not get paid for as much as you'd like it to be done. If you have a hole in your heart that you were born with called a patent foramen ovale, that's a hole between the two atria of your heart, that also can lead to strokes and so on, and it is recommended that you be checked out for them if, especially younger people having a stroke, or people with the significant heart murmur signs of that, and get that repaired. The repair of it is, well, it's not easy, but it's invasive with a catheter. You don't need surgery for it. Okay. Now, if you don't have pads, please, I'll answer pretty much any question you ask. Please give them to Howard.